Hi ladies, Caitlin here. I apologize that I have been slacking like crazy in the video department. I do apologize. Have just been I've just been busy now that I'm back at work. When I get home making a video, I'm not trying to be rude or mean, but it's the last thing that sometimes I feel like doing. I just feel gross after work. One of the symptoms I'm having, I'm swelling. My legs are swollen. I have kinkles already, and I pretty much just want to lay down and keep my feet up if we don't already have plans. I feel like these past few weeks have just been constantly go, 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 and I just haven't even had time for myself really. But today I am 21 weeks pregnant, and little Ren is getting so big. I had an ultrasound on Monday, and he already weighs 1 pound, and he is measuring bigger than a normal gestational age baby at this stage. And if you didn't know, my daughter, if you didn't watch my videos with her, you know that she was 9 pounds 4 ounces a week early. I had her at 38 weeks and 6 days, or I was 39 weeks. I know I had her a week early and she was that big, and he's already measuring big as well. So I'm probably going to have another big baby. But his big anatomy ultrasound was this past Monday, and praise the Lord, he's perfect. And of course I forgot my ultrasound pictures to show you guys, but he is he's adorable. He's finally starting to get that some fat to him and some fat on his cheeks, and he's not that like little bony skeleton anymore. So he's finally starting to get some brown fat on him, and he's just cute. And if you remember during my videos with Grace, and it's funny because she had the hiccups all the time while in utero. And one time I remember, like it was yesterday with her, I went for a prenatal massage, and for the hour that I was in a prenatal massage, Grayson got the hiccups 3 times in 1 hour, and I was just so uncomfortable. And this little guy, just in the little ultrasound that we had on Monday, he had the hiccups twice. And it's kind of cool that she said that he had the hiccups, because just a couple, it was just the day before, at church on Sunday, I was sitting in service and I was almost positive that I felt his hiccups, like the rhythmic, just like little tapping. And sure enough, he gets the hiccups quite a bit, just like his sister. And symptom-wise, I have been feeling, I've been feeling better, like nausea and vomiting-wise. That's in the past. Every now and then I will get slightly, sorry, there's a notification on my phone. Every now and then I do get slightly nauseous, but nothing that I can't control. I still do have that pretty big hunger feeling. My boobs are still somewhat sore, but not as sore as they were. My skin is still pretty dry. I have been very, very thirsty. I cannot get enough water, or, you know, something to drink. And I'm just basing it off of that because I've been drinking so much more. I still can't stop peeing. And I've been feeling his kicks and movements down really low. And in the ultrasound, his head was right at my belly button, and he was straight up and down. His head was right at my belly button, and his legs and feet, his foot was actually like laying on top of my cervix. And so the peeing frequently, his feet and kicks are always down there. So he's constantly kicking either my bladder or my cervix. And that's why some of his movements are already a little uncomfortable. I was finally, just within these past couple of weeks, able to see his movements on the outside. He is one of those babies that if you put your hands on the belly, my mom has been able to feel him. My husband hasn't yet, but I was with my mom when he was kicking hard, and she was able to feel him. So she was the first But whenever I put my hands there, he stops. It's like a comfort to him. Whenever the hands are there, he stops kicking right away. Symptom-wise, let's think here. Thirst, my stomach is just, it is just so much bigger this pregnancy. My mind is blown at how much bigger I am this time around than I was with Grayson at this stage. I actually look a few months more pregnant. I look like I probably did it like 8 months or so with Grayson, and I'm only, you know, just now over halfway done. But if you've watched my previous videos, you know that I have diastasis recti, where my abdominal muscles with my first pregnancy, with Grayson's pregnancy, separated. So I have about a 5-inch gap or so between my muscle bed to where everything is already pushed through. When I try to sit up, my stomach is football shaped, and pretty much all of my organs can, like, I know it's gross, but it just comes through. It does not have a muscle bed. So my doctor is a little bit concerned about that. He actually had me kind of strain and sit like halfway up during my appointment on Monday, because he wanted to check my herniation, and he did say that if I do develop a true hernia, which that just means like if I do get a pocket of like, or if organs do push through and don't go back, and I do develop a hernia during this pregnancy, really the only option for correction is surgery. So let's hope and pray that it just stays the way that it is, because that's manageable. It's just my stomach's never going to look the same. I'm never going to have those clear-cut abs if I work out. They'll just never go back together unless I have surgery and mesh put through or put in there to bring it back together. But so he is monitoring that pretty good. The next time I go, we're going to talk about my diabetic and glucose stuff, because I was gestational diabetic with my daughter. I was actually insulin dependent, and so we'll be talking about that at my next appointment. And another symptom, and I know I just mentioned this a little bit ago, but swelling. I am already swelling. Today I did a lot at work, and I was on my feet more than I normally am, and it's just, I don't have ankles. I don't have ankles right now. I would show you, but it's just ugly. I feel him move constantly, consistently. He is, I would say, not necessarily constantly. I shouldn't have said that. I mean, like, after I eat, he will move. And then, like, if I'm up walking around and I am really active, once I go to sit or lay back down, then he's really active once I rest. But I remember with Grayson, she was constantly a mover and a shaker. She was constantly moving. And I have a feeling that this guy might be a little more mellow than his sister, which I'm kind of hoping, because she is a pretty active toddler and is all over the place. And I'm thinking that this little guy might be a little more, you know, laid back. So we'll see. But on to what you guys have been waiting for. I just got out of my scrubs, so I just threw on a sweater with a tank top. It's a nude colored tank top, so no, I'm not naked. It's just the color of my skin, and some maternity stretch pants. So I will show you this huge belly. So let me back on up. So here is the front with a shirt on, and the side, and here is with the shirt up. Sorry if you guys hear Grayson, she's kind of being a little crazy, and if you can't tell, you can see all my stretch marks. I don't think I have any new ones.